All right, this is my adult audience, my nephew,
Hello.
and my wife.
Hi.
All right, let's get this speech started. Hello, everybody. My name is Dennis, and we are here to talk about how an office staff can help to give a new patient a positive experience in a chiropractic office. That's right. If anybody here has been to a chiropractor, we all know why we go there for. Is to get that adjustment to help us feel better, to get the body aligned. Now, let me give you an example of a patient that goes into a chiropractic office. The patient comes in with a lot of pain. He sees the doctor. The doctor was able to adjust him and help him to feel better. And the patient walked out with no pain. Now, the problem is that this patient didn't come back. Why didn't this patient come back? The patient was not satisfied with the office. The patient felt that the communication between him and the office just were not right there, and also felt that it took too long to bring him back. In this example, we see that the doctor was highly skilled, was able to see the patient, adjust the patient, and help the patient to feel better. But without the support of a strong staff, the doctor was unable to keep the patient. The patient ended up going somewhere else. For a chiropractic office to thrive, both doctor and staff need to work together in order to give a positive experience for their patients. The example that I gave is not a true story, but yes, the complaints are real and the patient's not coming in. That also is true. I have worked at a chiropractic office for 21 years as a chiropractic assistant and also an x ray tech. Within those 21 years, I have had three different owners. All three were very successful. The founding owner, the founding doctor, he was able to open up 11 offices. The one who took over right after him opened up three, and the current one, now in his third year, was able to open up another office. Now, all three doctors work very differently, but some of the things that they have in common is that they are successful. And at the same time, they value first impressions, that initial visit, helping the patient to feel better and also comfortable with the staff in the office. That way they can refer friends and family. So, today we're going to be discussing the steps involved in creating a positive experience for new patients. These steps include the initial contact with the patient, the care provided during the visit, and assisting the patient as they leave the office. Now that we know what we're going to be focusing about in this speech, let's get started. We will begin with discussing how the process starts, scheduling the patient appointment, reading the patient at the door, and bringing the patient back to the exam room. Our initial contact will always be when the patient calls the office and schedules that appointment. The staff member that picks up the phone should be able to be kind and courteous over the phone and also be able to be thorough with the information that they gather. Now, when the patient comes in through those doors, you want to greet the patient with a warm smile. Also, before you bring them back to the exam room, you want to make sure that that exam room is nice, clean, neat, and everything is in order. When the patient is in the exam room, you not only want to take the vitals, but you also want to be able to make sure that that intake was filled out properly and there is nothing missing. Now the doctor's going to go in, he's going to do the evaluation. After he's done with the evaluation, he's going to come out and prescribe some therapies, maybe even some x-rays. But whatever is done, you want to make sure that the patient knows what's going to happen next. Now we will focus on educating the patient about the therapies, the care being provided, and preparing the patient for the doctor. While you're putting the patient on therapy, you not only want to talk about what you're doing, but you also want to educate the patient. You want to let them know why this benefits them or how it benefits them. After you put the patient on therapy, you want to be able to check in on the patient, get some feedback, make sure that the patient is comfortable and there's nothing else that they need. Having a clean and organized room not only shows professionalism, but it also makes the patient feel comfortable. Before letting the doctor know that the patient is ready, you want to make sure that everything the doctor is going to use is at hand and ready to go. After the patient has been treated by the doctor, the staff needs to be sure that the patient has a good experience on the way out as they did on the way in. For our final point, we want to discuss the importance of making sure that the patient does not leave with any unanswered questions, walking them to the front desk, and scheduling the follow up appointment. Be sure to ask the patient if they have any questions or concerns or if anything that the doctor did, they did not understand, or maybe even any of the instructions that was given. Make sure that they understand everything. Walking the patient up to the front and explaining the sign out process not only makes it personal, but it also helps the patient to feel better. Be sure to schedule a follow up appointment if one was given by the doctor. Now that we have reviewed the three main points, let us briefly review. We have reviewed the new patient appointment process, beginning with the initial contact, the care provided during the visit, assisting the patient as they leave the office. Today, many people hear negative things or negative reports about chiropractic care through television, news, social media, websites, or even their primary care physicians or their orthopedic doctors. A skilled doctor, along with a good supporting and caring staff, can help reduce the doubts that a patient may have as they come in through those doors. Unlike the example that we gave in the beginning, we always want to make sure that our patients, when they need us, they come back.